Hello, I'm Witch Nikki. Uh, I went to the doctor yesterday. I got a whole bunch of papers to go through. One of them is about where to go to get my COVID vaccination. And I'm kind of scared to go get this done by myself. But I guess I'm going to have to. Um, I'm not going to talk about that right now. A lot of this is medical terms, but she went and printed out my test results, and then she went over it for my hemoglobin and hematocrit. I'm not good at pronouncing things sometimes. I have no anemia, so that means that my blood is irony enough. I'm not anemic. Okay, that's good. My glucose that I thought was a little bit high, because the reference said 65 to 99, and it is just a little high. She said 103. But she said it was okay. She said just a teeny bit high, she said. My kidney is functioning normal. My liver is normal. My LDL cholesterol is high. The goal is 100, she said, but I have 143. So I got to work on that a bit. The thyroid situation. She did say that it was my left side, so I guess that's kind of good, because after my biopsy I noticed it was kind of swollen, and it still is. But there's something called the T4, and it is the result was 1.2. So it's kind of low, I think she said. Yeah. Or is it high? And then there's another one of TSH. What does it say? The results was 0.02, and the reference was 0.40 to 4.50. She says that could come from an increased biotin, and I haven't been taking biotin. So she says that it could also be from stress. So also, here is a teeny bit high of my T3 was 4.3. So it's kind of high because the low, the reference is between 2.3 and 4.2, so it's just a teeny bit high. So she's not real worried, but there is definitely something going on there. Let me see. What did she call it? Hashimoto's? But it's not. She said it's not. She was thinking Hashimoto's. I don't know. Probably spelled it wrong. Hashimoto's disease. When they put disease at the end, it just makes it seem like you're gonna die. It is when the immune system attacks the butterfly-shaped gland in the neck or thyroid. Initially, inflammation of the thyroid causes a leak resulting in excess thyroid hormones. Over time, the inflammation prevents the thyroid from producing enough hormones, causing hypothyroidism. Symptoms include fatigue, unexplained weight gain. Treatment with synthetic hormone medicines is usually effective. So it is treatable and everything like that, but she was just thinking how I don't have the other symptoms. Let me go into one of these sites. What is this one? Mayo Clinic. That's pretty reliable source. Okay, so you want to get on a reliable source when you got things like this going on or anything. So the symptoms, here's a lot of the symptoms, and some of them I might have, but not constantly. Fatigue and sluggishness, sometimes yes, by the end of the day, but who isn't tired at the end of the day? But yesterday I was just so, I had terrible headache. The back of my neck was just throbbing. I had some in the front of my neck, head, and I was so tired I just went to bed early. So increased sensitivity to cold. Well, it's been very cold, but I haven't really had like an intense sensitivity to it. Constipation, no. Pale and dry skin, well, I've been kind of this color all my life, so no, don't think so. Dry skin, that comes in the wintertime, and you got to drink plenty of water every day. I during the summertime, I'll be drinking these like crazy and going to the bathroom all the time. So everything works. But during the winter, have you ever noticed that you just don't get thirsty enough all the time? So you just have to make the effort to keep on drinking water, whether you're thirsty or not. Because sometimes some of these symptoms come up through that. Without drinking water, you get dehydrated, lightheaded, maybe, stuff like that. So, a puffy face. No. I got a baggy face, but it's not puffy. If anybody had tape, see how lovely I would look if I had all this stuff taped up or sewed stitches up. Please, I'll just have to be how I am. This just got skin that hasn't, that's how it is. Hair loss. My hair is kind of dry, but I've been doing better with it, actually. I don't know. Sometimes I kind of worry about that, but oh well. That's not where I wear my hat. I like wearing my hat. It's kind of like my trademark now that I put my beads on it to express myself and my artwork. I feel if I wear my own stuff around, people will see it and say, "Wow, isn't that nice?" or "Isn't that lovely?" If they do or don't, it don't matter. This is my own stuff, so I'm wearing it. Enlargement of the tongue. Nope, it's pretty regular. Unexplained weight gain. Okay, the big key word there is unexplained. So if it's explained, okay. Muscle aches, tenderness, and stiffness. I have that all the time, and I've had it for years. I had it since like in my 30s. Okay, so and it comes and goes. The other day I told her I was so concerned about COVID, and one of the symptoms is muscle aches and pains and stuff like that. And I said, how do I know if it's just the regular stuff that I wake up every day with or something else? And I said, then I didn't even wait for her to finish to start talking, but I said, usually it's in the morning, and then throughout the day, most of the day, I'm fine. But it's like, and then it comes back in the evening. She says, okay, then that's that. That tells you it's not COVID. If you wake up and you got something and it just feels like you've been hit by, a truck or something, or and it doesn't go away all day long. It stays the same or feels worse. You know, pain all day long. That is a warning that it could be COVID. But I wake up stiff from sleeping where I gotta sleep and stuff like that. So, excessive or prolonged menstrual bleeding, no, don't have that. I've had a hysterectomy, so I don't have that. Depression, okay, and I've had that for years. Memory lapses, I do get that. So, some of these things, yes. So, I could see why she would think that maybe it was that she was checking over other things. And it says when to see a doctor. Tiredness for no apparent reason. Okay, so I get tired, and it's usually for a reason, because I'm going around here doing stuff for everybody that my daughter works, my roommate works, so I help them out around here with other chores that they do some stuff on their own, but I help. Dry skin, it says, pale puffy face, and constipation. So see the doctor when you got something like that. Okay, and now remember, this is called Hashimoto's disease. And cause, let's see, what else did it say there? You also need to see your doctor for periodic testing of your thyroid function if you've had thyroid surgery, which I haven't yet. You've had treatment with radioactive iodine and antithyroid medicines, and I haven't had that yet. You have radiation therapy to your head, neck, or upper chest. No, I haven't had that. If you have high blood cholesterol, talk to your doctor about whether hypothyroidism may be the cause. So I guess she's saying it's kind of acting like this, but it's kind of not. So maybe it's all the stress that I'm going through. Complications. So I'm not going to keep going into the details, because she said she thought it was this, but it wasn't. And it's at the mayoclinic.org. And then you can just look up Hashimoto's disease. Let me see. HASHIMOTO' disease. That's at the Mayo Clinic, mayoclinic.org. Okay. So also, when she was listening to my back for breathing and stuff that she listens to, and she looks at my back and she says, boy, you really have a curvature of a spine, don't you? And I said, yeah, I do. It's something I was not aware of until I had my first child. And when they tried to give me a spinal block for a cesarean section, they had problems with giving me that. They said, oh, you have a terrible curvature of spine. And that's something that growing up, nobody ever told me. Except my mom used to tell me, you need to sit up straight. Well, I would, but after a few minutes, my back gets so tired of holding that position, and maybe I need my curvature is probably just not going to go away, but maybe that's one thing that I need to do more is sit up. But so it made me kind of feel bad that it was that noticeable. So I asked my daughter to take a few pictures. I'm not going to show them. She already deleted them. I told her, I said, delete them. I don't like the way my back looks. And I'm not vain or anything. It just makes me feel kind of bad. The reason for that, and I'm working with the emotions about it that come with this feeling. Most of the old hag pictures and old witch pictures that you see have them having this big, large hump on their back. Like, the one that comes to mind, to my mind the most, is the witch on Snow White. Let's see. But most all of those are TV witches. But you always hear about witches having a humped back and stuff like that. So it gets to me kind of like, I don't know. Is this something I should be proud of? Is this a mark of, being a witch? No, I don't think so. So it's just something that I have to learn to live with, I guess. She said, that must be very painful. Is it very painful? And I said, yes. Have pain every day in my back. But if I just sat around or laid around, it will just get worse. And which is why if I do a video, it's just about a half an hour is about all I can take. And also, I guess my phone doesn't like, my camera don't like doing long videos. So, I was trying to look. Why does it come up? I'm looking at pictures of witches right here, images, and Trump's picture comes up. I'm like, why the hell? I do not want him classified as a witch. Maybe because he said they're doing a witch hunt for me, and he should never have used that analogy. Please, Trump, you are nowhere near the high classification of being a witch or anybody witch hunting after you. You're going to be hunting something else, but definitely not a witch hunt. Maybe like, I'm not going to get into it. Let's see, witch's hump. Let's see if I can find any. You always see them witches like that. And these humps that they have on this. Let's see. This seems to be from a Harry Potter. I'm going to turn it around. See that? I'm going to bring it up a little bit so you can see. So, statue of Grunhilda of Gorsmore. So yeah. I don't know. I'll talk more about that. Oops, sorry. Back around. Ding. But I had heard or read that there is this old book that was written up by a couple of men. I forgot their names right now, but they wrote The Witch's Hammer, which was a way to locate, find, hunt a witch, and how to tell that they were witches, and what to do to destroy a witch. Okay, so it was a very terrible book. centuries ago. And so that was one of them, the mark of a witch, like these little birthmarks here too. That's why if I have one of these, and I've had this ever since I was probably a little girl. I can remember seeing this in the mirror. And I go regularly to get them checked, and I don't let them take this off. This is mine. And my mom used to call them a beauty mark. And that's what I like to look at it. But I've also since, seen it was supposed to be the mark of a witch that you have them. I have another one right here. Okay. Now, whether it really, marks a person as being a witch, I don't know. That could be just maybe fictional type thing. I don't know. And definitely not the back thing, but supposedly it's a curvature that goes from the side, not, well, I don't know, maybe it goes this way. It was really hard for them to get me a spinal block when I was going to have a cesarean section with my oldest daughter. But, and then I had problems with it too after that, but I'm not going to go into all that information. But yeah, so here's another one, but it's a drawing. So every time you see a witch, they got to have this hump on. Yeah, that's just somebody's drawing. I don't know who. All these witches got to be green and have warts everywhere. And these are not warts, okay? These are just beauty marks. I call them beauty marks. Moles, okay? And these have already been checked out by my doctor, said that they're not dangerous. So I'm leaving them. Even though the doctor that checked me out from here, I have a new doctor now, and she was blown away when I told her, yeah, the other dermatologist told me, well, that's just ugly. You want it removed? It makes you look ugly. And I was just like, no, leave it alone. I had one under my eye, and like right about here, and they removed that, and one down here somewhere, and they removed that. I had another one also near here when I was a teenager, and they removed that. They did biopsies on it. I don't remember. I didn't have any cancer on that one or any of the ones that they found recently. But now I have a new doctor, and a new dermatologist, and she checked everything. And my doctor, my family doctor, for me, she's just wonderful. I found out that she is also Wiccan. So I'm not going to name her name, but just for her privacy. But I'm so happy that I found her, because one time she was looking at my back to look at those spots and those little spots and stuff, and she's like, and here and my stomach and area and stuff, and she just said, someday I hope I got some of those little spots on me, she said, because she thought that they was pretty. And that's the first time anybody's ever said that to me. That's not the only reason why I just love her. I mean, I really love her. Because she did tell me that she was Wiccan. I had told her why I don't take a lot of medicines unless they're absolutely necessary. And a doctor back about more than a year now, because I've been with this doctor a year, so more than a year, ago, I had another doctor, and he, uh, well, actually, he was the PA for the doctor that I was supposed to see, and I never saw that doctor except one time. And she just wanted everything. Just, you need to take and remove all of that stuff. And I'm like, I'm going to have it checked first, and then if it's dangerous, they can remove it. But if not, it's staying. That's another reason why I didn't like the other dermatologist, because in his office, it made I felt so ugly in that office because of my wrinkles and saggy, baggy skin. Now, see, because we've been trained by society that if you don't look like this, well, then you're just ugly. And that has got to change. If it's changing for people who are born with deformities and differabilities, then it has to change for people who have along the way either had horrific trauma and accidents to their bodies, like acid thrown in their face, or a fire, or an accident where some limb has been missing, or any of that, including old age, which is a natural process for your body and face and everything to be going through. Why do people see that as like, oh my God, I got to change that? Would I look better to everybody if I just sat here like this? I hate to see in TV shows like Days of Our Lives, and some of them older women who've been on there for a hell of a long time, okay? And you see them all perfectly stretched and smooth and everything. They look like they're 20 or 30, and you know that they're in their 60s or 70s, some of them. Well, then you see them with gloves on. What? They got like, regular clothes like this, and they got gloves on. You know why? Because they're not going to get their hands surgically altered. There's not really too much you can do. And I'd imagine it's pretty painful. I don't know what. How do you remove all the joint problems you might have, and age spots and stuff? I mean, there's chemicals and stuff that you could put and do and all that kind of hogwash, but then I'm sure that some of them's got bras that help lift their twins up to make them look all perky still. Jesus. Oh, good Lord. Just grow old and be happy about it. Don't worry about how beautiful the young people are. Shoot, there's little babies that look old sometimes. People are fondling over them and like, oh, how cute. But then as soon as we get old, it's just like, oh, don't want to go there. But you want to look like a round face, squishy face little baby? You'd rather look like that? No, I know you don't. You don't want to go that far. You just want to go somewhere into where like you're between 20 and 30 maybe. Well, news flash, it don't work like that. You either got to have lots of money and go through sometimes pretty dangerous procedures. And some of them, from what I've seen, have gotten botched up badly. So I'd rather just go through whatever nature's going to intend for me and my droopy skin. Get some tape, tape it up, tape it up. See, like that? See? Or you can use those trick camera thingamajigs, those apps that make you look younger. I saw this one girl changing herself in one of them apps, and she was like all pretty, like in her 20s, 30s, something like that. Ladies can still be pretty into their 40s. And even now, what am I saying? Even now, I'm in my 60s, and we're still pretty. There's different stages of prettiness. Okay, so what I think I mean is not pretty, but youthful. So if you ever see me in a pose like this, you'll know I'm bringing up my wrinkles and stuff. Because this here's my app. Oh, the girl was going on about her face change into an older woman. And she was like, gee, thanks, Grandma. Oh, I look just like my grandma. Ugh. How dare she? How dare she say something like that about her grandma with disgust in her tone and her voice? If she was my granddaughter, I probably would have smacked her butt. Ginger don't care how I look. She just loves that I'm getting shorter too, and I'm getting shorter because of that curvature in my spine. It's making me a little bit shorter, and Ginger just loves it. I think she would just love if I went to be about 4 feet tall. She would just love it. No matter if I'm hunched down like this, and she would be way up there and like, hi, Grandma, you know. So, yeah. You know what? I love you all no matter what you look like. And I've been seeing a lot of different looks and abilities. People are born with different features. And going through some stuff that I've never even seen or heard of before. And when I look at them, I think, wow, that's just amazing. And how brave even a little baby has to be growing up in a world like us where we can't even get along with white skin or dark skin. That's considered something that we have to get along with, white skin or black skin. And it might not just be the color, it might be what's deep, deep inside mentality of a white person think that they're better because of their lighter skin. So anyways, I'm going to go for now because I think I'm going to get ready for a bike ride. Now that the doctor said that I'm not dying from something mysterious and that my blood work is just okay. It's fine. And about eating, Michelle's been making this lasagna almost like every other week or every week. And she just said, and I told her, I said, my daughter's cooking really good, but she makes a lot of comfort food that might not be that good for me. And she said, well, you continue to eat that food. Just eat less. Have a smaller portion of it and a larger portion of vegetables or a salad. And she said, and do try to get on your bike. You don't have to be afraid of COVID out there on your bike because you're riding your bike and you keep your distance, mask up if you're close to anybody, and you don't have to wear a mask if you're out there riding your bike. So I'm going to post this with love out to all of you. I love you very much, and have a great day. And don't tape up your faces. Don't get no surgeries. You're lovely just the way you are. Love you.